recent study found being lonely and socially isolated can contribute to the risk for heart disease, especially for older women. This morning, cardiologist and women's heart health specialist Dr. Amy Pollack joins us now to discuss that study's findings and how families can help their loved ones. Thank you so much for joining us this morning.
Oh, thank you for having me.
So this study found women, particularly those likely in menopause, ages 65 and up, were more likely to develop heart disease, especially if they were feeling lonely or were isolated. Can you tell me the link between socialization and heart health?
Absolutely. And so this was a really important study, and it's interesting that this was done really over about a 10-year period from in the kind of the early 2010s. And so this was even before the pandemic, before this kind of more extreme social isolation and loneliness that folks have felt. So that social isolation is when you're not getting out there interacting with groups of people, with your support networks. And that loneliness is when you're not having that kind of one-on-one interaction. And they both are associated with the higher rates of heart attacks and strokes.
And of course, COVID has certainly made us stay socially distanced, but that's not the same. And what are we seeing happens to the heart in people who are less social?
So, we don't understand a lot of what drives that increased risk. We certainly know there are some important threads or themes. When folks are feeling more lonely and more socially isolated, they oftentimes aren't getting as much exercise, which that lack of exercise is certainly bad for the heart and blood vessels. They may not be going to doctor's appointments. They may not be eating as healthy. They may not be taking care of themselves or paying attention to their symptoms that may be warning signs that there's something going on with their heart or blood vessels. And there's some interesting data to suggest there may be a higher level of this oxidative stress, inflammation in blood vessels that can lead to higher rates of heart disease and stroke related to loneliness. So our emotions and our feelings certainly can affect our body and our blood vessels.
That's very interesting. And, what is increased risk? Why are women who enter menopause, why are they the most vulnerable? And what are those increased risks for when they enter that time?
Absolutely. That's such an important thing to highlight, because for women, as we go into menopause, we start to lose these levels of estrogen that we, for the most part, have enjoyed for our other adult years in life. And that drop in estrogen is one of the factors that influences our blood vessel health. And so blood pressure tends to go up as we age, and upwards of 80% of American adults will have high blood pressure diagnosed at some point. And then there are the confounding factors of changes in activity or diet as we age. And I think now more than ever, making sure that we're healthy across the lifespan and living vibrant, active lives is so important, whatever our age.
And, what other advice do you have for women to help protect their hearts, especially older women?
Absolutely. So I think there are really 5 key areas that I would recommend. So the first one is know your numbers. Make sure that you're taking control of knowing what's your blood pressure, your cholesterol, your weight, your blood sugars, knowing how those factor into your risk of heart attack or stroke. Second is you need to know family history if you're at a higher risk of these events for your heart, and then paying attention to symptoms. Third is that we all need to get out there and get active. And that can certainly help with that social isolation and loneliness. I know when I felt lonely and socially isolated, I'll call a friend or grab a relative and say, let's go for a walk. Let's get outside. So that exercise is so important. Fourth is that heart healthy diet. What we eat matters. The Mediterranean diet is associated with a much lower rate of heart attack, stroke, and even death. So what we eat matters. And that fifth, last but certainly not least, is that mental wellness and well-being. That's really combating that loneliness. Sometimes when we feel lonely inside, it's so hard to reach out. But take a micro step. Call a friend, send a message, get together and kind of fill that emotional bank to help combat that loneliness. So those would be the 5 tips for heart health.
Those are wonderful tips. I definitely didn't know the Mediterranean diet could help with your heart as well. But thank you so much, Dr. Pollack, for joining us this morning. This is all wonderful information.
Thank you for having me.